Okay, now we're at the drawing board. And as I mentioned, I want to go over the explanation of why degeneration is not normal, why degeneration is not a normal part of aging. And remember, degeneration and arthritis, they are just a adaptation to an injury done. So when you look here, look at this. This is a 56-year-old male. These are recent x-rays that we've taken on patients. And what you'll notice here is a nice curve, and every bone is the same shape. Don't mind my little pointer here, but every bone is the same shape, okay? And it's a nice uniform curve. The alignment of the head is such where it's over the shoulders, nice upright posture. This right here is a 17-year-old boy. And what you'll notice right off the bat is he's lost this curve. This what we refer to as text neck, or a child that's at a computer all day long, or they're watching TV too much and they have that forward head posture, or their sleeping position is wrong. And you have this forward head posture here where you're losing the actual structure of the spine. And you can notice right at this level, I know it's a little difficult to see, but this bone shape is very different than that bone shape. What happens is it's elongating. This is actually a child. I shouldn't see this damage on a 60-year-old, never mind a child that's 17 years old. What happens is lost the curve, and now this joint is starting to malform. The bone is starting to become degenerative. And then now here's the 23-year-old. Remember, this 56-year-old, this is what it's supposed to look like. Now you look at 23 years old, and so it's this x-ray that's just a little bit more progressed. This bone right here, again, losing getting the reverse arch of the curve. But this bone right here, you have a different type of shape. You're starting to get this bone spurring at the end. So you'll see this progression, and look at the age difference. The ages of the x-rays are getting younger, not older. People, and the reason why I put this is people believe that this is a normal aging process to have degeneration and arthritis. And it's not the aging process. You have to understand, degeneration and arthritic changes are time dependent. They are not age dependent. And what that means is it takes a certain period of time to get here, but normal is this. And then this is a 46-year-old, remember 10 years older than this, they have a spine of an 80 or 90-year-old. And I'm just saying that, not that an 80 or 90-year-old should even look this bad, but what happens is total reverse cervical curve, more progression of these x-rays, if these patients never came into our office, would progress to this. And then you see severe degenerative changes in somebody that's 46 years old. Now, what I'm going to say, what we're talking about right here is just the structure of the spine. If this was a knee, this structure would not have a problem with the function of the body, or it wouldn't have an issue with how your health is affected. But because this is your spine, you only have one spine, and the spine protects your central nervous system. The next picture I'm going to show you is what this actually looks like at a nervous system level, and how this compromises the health of each individual patient.